It is 9 o'clock on a Tuesday morning. A 68-year-old man is brought to Frankston Hospital with chest pains and shortness of breath. An emergency medicine team responds to his crisis and soon he is under treatment in a well-equipped coronary care unit. Meanwhile, the members of a psychiatric crisis assessment and treatment team assist a client and her family through a mental health emergency. By reacting quickly and providing counselling and support in the patient's home, the team hopes to help the client avoid hospitalisation for this episode of need. Only a few kilometres away, clients begin arriving at the Frankston Community Rehabilitation Centre. Some are attending a falls clinic, where they'll be assessed for their risk of falling and taught exercises and strategies to reduce that risk. In hospitals, rehabilitation centres, nursing homes, hostels and mental health facilities all over the Mornington Peninsula, people are seeking treatment, care and support for their health. Providing services they need is the goal of the Peninsula Healthcare Network. The health professionals of the network know that the region is unique and that the services they provide must meet the specific needs of this community.
Here in the Peninsula, we're a long way from the Melbourne City hospitals. It's important that the health services patients require are available close to where they live. That's especially important for our patients in the chemotherapy unit. They need to concentrate on getting well, not on spending hours each week driving long distances for the treatments they need.
The Mornington Peninsula is a popular retirement area, and so we have a high proportion of older people living here. To offer elderly patients the health services which are designed for their special needs, the Health Network has combined the expertise and resources of the acute hospital with those of the aged care and rehabilitation services and input from general practitioners. Morning, Mrs. Butterworth. We call this integrated care and is one of the high priorities at the Peninsula Healthcare Network.
Over 250,000 people depend on us to be ready when they need us. So the network has many services, including obstetrics and special care nursery, that are available around the clock every day of the year.
And healthcare staff are developing new initiatives and methods to enhance the patient care system. This means that when a patient arrives within a network hospital, they will receive the most appropriate healthcare as quickly as possible. And these efforts have been worthwhile. In the first 2 years of this network, we've been able to treat some 20% more patients. And this has reduced the waiting list by some 10 to 20%. I think that's a good effort.
Patients want to know that the staff who take care of them are skilled and knowledgeable about medical advancements from around the world. So the network continues to develop its education programs, its communication and information technology systems, and its relationships with other healthcare providers and universities.
That helps assure that the staff here are up to date with the latest developments in healthcare.
The Mornington Peninsula community is growing at a much faster rate than most other parts of Victoria. With population predicted to rise by 26% in the next 15 years, it remains vital that the healthcare network plans well to meet future demands on healthcare delivery.
The government is working with the network in developing a number of new services, including comprehensive palliative care for people in the final stages of their life, angiography services for coronary patients, integrated healthcare centres providing a broad range of day services, rehabilitation for younger people with disabilities. It is indeed an exciting time to be part of this network.
The Peninsula Healthcare Network shares its optimism and vitality with a dedicated contingent of more than 650 volunteers and with a supportive community that contributes to the network resources through donations. Together we make a good team.
By the end of this typical Tuesday, the Peninsula Healthcare Network has delivered acute, psychiatric and aged care services, as well as residential care and rehabilitation to more than 1,000 people. Emergencies were managed. Babies were born. Pain was relieved. Advanced technology was paired with programs that promote health and acknowledge individuality. The trust given by patients and clients to their healthcare teams was met with skill and vigilance by a caring network staff. Who'll do it all again tomorrow.